Association in this effort this summer. It's been great to be able to reconnect with a lot of folks that I've missed working with. So I'm going, here we go. The Tennessee Primary Care Association, the mission is to improve access to primary health care through leadership, advocacy, and support as the voice of community health centers. Tennessee Primary Care Association is a nonprofit statewide membership organization working to strengthen community-based primary care health systems in Tennessee. It's important to know that we are a membership organization, and our members, our core members, are Tennessee's federally qualified health centers, which is also FQHC. Some of you will be more familiar with that term. We do have other members, though. They include faith-based clinics, rural clinics, and some free primary health care clinics. Tennessee Primary Care Association provides these services to our members. I'm going to go through them very quickly: governance training, clinical training assistance, public relations and marketing, health information technology, especially around electronic health records that are all the rage right now, workforce technical assistance, advocacy, telehealth technical assistance, and this is where folks in other parts of the state can take advantage of specialists or interpreters who are in Nashville, but they are able to reach out to other parts of the state through this telehealth equipment. And then also FQHC funding and development technical assistance. A federally qualified health center is a private, non-for-profit health center. They provide high-quality, cost-effective, comprehensive primary and preventive care. They're open to all. The receipt of services is not contingent on their ability to pay or their insurance status. They have a sliding fee scale. They're located in high-need areas, and they are required to meet rigorous quality of care, service, and cost standards. Now, I've spent a little bit of time on this because even though I've been working in the healthcare field here in Tennessee for quite some time, I still wasn't quite sure what differentiated a federally qualified health center from a non-federally qualified. I wasn't sure exactly what TPCA did. So I want to make sure that everybody understands that TPCA's role is to provide this technical assistance to the qualified health centers who are required to meet certain quality standards. And so some of those services that are provided to all ages by the federally qualified health centers: primary health care, dental care, behavioral health services, pharmacy, basic laboratory procedures, and emergency care. This isn't a full list of what the FQHCs do, nor do they all provide them in-house. Sometimes these services are contracted, but all the FQHCs must provide these services. In Tennessee, there are 26 federally qualified health centers. These organizations have more than 200 sites across the state that can be located in rural or urban areas. In 2012, Tennessee FQHCs saw 384,109 patients. FQHCs are a very diverse group, though they all provide core services. Some organizations have special focus areas. And I believe Andrew passed around a sheet that has a map of the FQHCs across the state, and also has more information on the back of that map about FQHCs. In 2012, the patients that were seen by FQHCs, 84% of those were at 100% federal poverty level or lower, and 13% of those patients were between 101 and 200% of the federal poverty level. It's important to know that not every patient, we weren't able to collect the income level for every single patient, but for those that we did, 84% were at 100% FPL or lower, 13% were between 101 and 200. And then if you look at their insurance status, 41% of the patients were uninsured, 32% of the patients were on TennCare, 17% were commercially insured, and 10% of the patients were on Medicare. So I'm going to go quickly to why the FQHCs are involved in outreach and enrollment. They are trusted by community members and patients. They have many connections to other community groups, and they are a network of providers rather than individual clinics. HRSA has provided funding to the FQHCs across the nation to help with outreach and enrollment efforts. Now, outreach and enrollment is a whole new term for the folks who are going to be working to get folks enrolled. Outreach and enrollment is the term that was used by HRSA to present the grants that were available, and so that's what we're using until we're told otherwise. We're not. I think the FQHC staff are going to be sort of a combination of navigators and CACs. We'll know more as it goes along. So HCFA funded FQHCs in Tennessee. There were 25 awards granted, totaled $3,166,282. These funds support up to 65 outreach and enrollment workers that will be spread across the FQHCs. There's a very complex formula about how it was decided, how much funding each of the FQHCs could do, and I'm not even going to try to explain that, but I'll be glad to give you a website. FQHCs are expected to do in-reach as well as outreach. In-reach is reaching those folks who come through their door and helping them understand the Affordable Care Act and how to get enrolled. Outreach is going outside their walls, reaching out into their community to help find those people who could potentially be eligible and help them enroll. And that's why I think the outreach and enrollment workers that are funded by HCFA are going to be kind of a cross between the navigators and the CACs. They will, of course, all be CACs. The Tennessee Primary Care Association has also received funding for outreach and enrollment. The Bureau of Primary Health Care funded primary care associations across the state, and we were across the nation, and we were one of the states that got funding from the from the Bureau of Primary Health Care. And we've added outreach and enrollment staff to assist TPCA members. We have applied for private foundation funding, so I put potential there. This private and foundation funding that we'll know about later this fall will allow us to provide the same services to non-TPCA members as we're going to be able to provide to TPCA members. And then we also are one of the 3 organizations that we know of who have applied for part of the Navigator Grant in Tennessee that we will find out about mid-August. Our Navigator Grant proposal, TPCA's Navigator Grant proposal, is a comprehensive statewide strategy to do outreach and enrollment, to work with the FQHCs and other community organizations to support and to supplement the other outreach and enrollment strategies. We will be developing messaging specific to Tennessee, or I guess working with others who are also developing messaging. We will boost our O&E effort, outreach and enrollment efforts, by coordinating events. We will be implementing outreach and enrollment efforts, particularly in those 13 counties not currently served by a federally qualified health center. We requested funds that would allow us to add a lead navigator, 8 additional navigator staff positions, 1 in West Tennessee, 2 in East Tennessee, and the remainder in the Middle Tennessee area. And we want one person that would focus primarily on outreach and enrollment efforts for special populations, which would include anyone who might experience a challenge enrolling or going through the enrollment process. And as we all know, that's a wide variety of folks who could experience challenges. We also have a plan for 3 contracted workers. 2 in West Tennessee and 1 in Middle Tennessee, and then strategic partnerships, and that would be with folks like the Tennessee Mental Health Consumers Association and others who are very specifically concerned about their populations. What we will be doing is, this is what we are doing with the funding that we got from HCFA, and that is to add an outreach and enrollment coordinator to provide initial and ongoing support to outreach and enrollment staff. We have monthly group calls, we disseminate alerts and updates, we offer training, we're offering on-demand technical assistance just as quickly as we can learn what we need to know, and we will be assisting the CACs with completing their certification requirements. And essentially, we all know, are very aware of the fact that this is a huge effort. There's plenty of work to go around. There are fantastic leaders right here in this room and across the state, and we are here to stay connected to each other so that we can connect those folks that need it to the healthcare services that they need. Thank you.
Thanks, Randa. Hi, everybody. Are you awake? Yeah? It's hard, right? We've got the hard job of speaking right after lunch, and it was a good lunch, I thought. All right, so I'm Lisa Pote. I'm a senior vice president for Seedco. Seedco is a national nonprofit intermediary. We have offices in Memphis. We have offices in New York City, and yes. Really? Yeah. Do I have to stand by it, or is this okay? Wait, okay, but how's this? Is this okay? I'd rather not. Dang it. All right, okay. All right, it's not that I'm afraid of a mic. I was Peter Pan in the 5th grade play, so like I can hang with the mic, but I just didn't want to have it in my hand. All right, so I'm Lisa Pote. I'm Senior Vice President for Seedco. Seedco is a national nonprofit intermediary. We have offices in New York, in Atlanta, in Baltimore, and in Memphis. And I manage the Memphis office. And before I begin, I really want to know who's in the room. So you can raise your hand, you can say me. Who's west of Nashville in the room? Okay. 3, 4. We had a few more, right? Okay, good deal, okay. Who's in Middle Tennessee? Now we know where everybody's from. Okay, who's east? Oh, that's awesome. Okay, who's like way the heck east at the end of the state? Very good, okay. Shout out for way east Tennessee. Okay. It's great. It's such a beautiful state. I'm originally from D.C., and my mom says, boy, Tennessee is really long and thin. I don't know how you're going to do all of that. We're going to do it with you. That's what we're going to do. So when Seedco entered the conversations, when it became clear that we needed to manage this ourselves, which, I'm totally okay with. Okay, the governor made his decision not to run our marketplace. We are partnering with the federal government to do great things. I know that we can do this. And just a show of hands from y'all if you think that we can do this. Okay, that is so exciting to me. So I just want to let you know that it's going to take everybody. And it's going to take everybody knowing what we're doing, mostly. Okay? People who don't know are really going to need us. This is the time. This is the moment. It's like now. It's one of the most important moments that I can think of in our history. That vulnerable people need us. Period. Hands down. So, this is us. How do I even? To the right. Dude. Okay. So, we know that we have, without Medicaid expansion, around 500,000-ish people that are eligible for this, okay? Now just to remind you, they're between 100 and 400% of poverty, and they're a group of people that haven't necessarily been through the doors of many organizations across the state. The working poor, they're very self-reliant. Where are they, y'all? Where are the working poor? Okay, they're at work, yes. They're absolutely at work. Okay, so when I think of working for, I've been doing workforce development and poverty work for a long time, okay? They may be at tech schools and working a part-time job, okay? They're shopping at Walmart, okay, and other big box stores. They are showing up at VITA sites to get their taxes done, right? They're at churches. They're in your neighborhoods. They may be at food banks. Okay, right? Because, okay, help me with the numbers, y'all who know this. 100% of poverty for a family of 4 is? 11 for an individual, but for a family of 4, I think it's like 40-some thousand. Okay, up to 94,000. Just their round numbers, and I can't keep them in my head anymore. Okay, so we're talking about a completely different group than we're used to. All right? So they're going to need different messages, and they're going to need different kind of engagement, and we need to do that. So the federal government did not think that many states would turn down the opportunity to run their own marketplaces. So they had 50 million to begin with, which was great, but they had 30-some states decide, no, you do it. Well, divide the 30 into the million, and for Tennessee, you get 1.4 million, which is ridiculous. Ridiculous. In Maryland, where we're running one of our programs, we're doing a navigator program on the Eastern Shore. We got $3 million to register 10% of the people that will be registering in Tennessee. So, with Medicaid expansion decisions, there are a lot of people who aren't eligible, and they'll be showing up too. Okay, they're going to require really thoughtful help from us. There's so much confusion. I mean, y'all walked in confused. You can admit it, we're all friends now. You were confused, right? Like, what in the world? So if we're confused, we know that people that have next to nothing are very confused by this. There's a mistrust of government. I know you're surprised by that. And of the ACA. And there are people working against it every single day. Articles in the paper every single day, right? News people saying it's bad, it shouldn't happen. We can have a conversation about that later. But anyway, the political environment right now at the same time is it's got to be right. But look, I know it has to be right because healthy people work. Healthy people contribute to their families in a completely different way than people who aren't healthy, right? So, and every person has a right to be able to contribute to themselves and their communities. Regardless of whether you feel healthcare is a right, everybody has value. This is a way to make that happen. So you can obviously tell I'm an optimist. I own it. I'm a 4th generation optimist. It can be tracked back ways. And my kids are probably 5th generation optimists. They just don't know it yet. But I personally think that 1.4 million is possibly the best thing that could have happened in Tennessee. Because if it were $20 million, what would have happened? Lots of infighting. Lots of fractured delivery system. 1.4 million is just enough money for us to build a system with. And I'm a bridge builder, popped out that way. So this is what we're going to do. Okay? There's an amazing number of providers, and Mary Lynn Salter is in the room. I got phone calls from a bunch of folks saying, look, we don't want the money, we just want to come work with you. Those of you who have been in the business for a long time, when was the last time that happened? This doesn't happen, right? Because everybody knows it's not enough. It's not enough for me. It wasn't about me at all. It was about the people that we care about. That was the most important thing. So the important thing now is that we leverage the strengths of everybody. All right? Now,